That's why people are like, oh my God, my stomach is hurting, and that's where the belching comes in, the gassiness, the distension. You got to open your pants up because you can't breathe, all that good stuff. But once you have a bowel movement, a lot of times it's very forceful, right? Why is it forceful?
It's under pressure.
It's under pressure. Fermentation creates air. So your colon is only 2.5 inches in diameter, literally. But keep in mind, it's not empty. Your colon is never meant to be empty. It's always full. But it is meant to operate effectively and consistently move like a chain reaction, right? So if your colon is 2.5 inches in diameter, and then you have fermented food, it gets smaller. Then you have mucus, which most people do have mucus. It gets smaller. Now you have air in there. Now it's even smaller. And now you have dehydration, which makes everything a pasty, sticky mess.
Yeah.
Now you have like that much to move food out of. And then top that off with not being active, you're not drinking water, then you're also consuming high amounts of caffeine, which makes it even tighter. Now when you get to sit on the toilet, you're trying to push some stuff out and you can't, there you go, a hemorrhoid or 3. Now you have hemorrhoids trying to push this waste out. Then when you go to wipe yourself, it's very sticky, very thick, and the smell is very toxic. So now you're spraying stuff, so your man or your wife won't kick you out the house, right? So you see how our food can play a huge role in, not even only your food, but how you chew your food can play a huge role in what happens when it gets down to here. So let's talk a second about gum, for instance. I see a couple people chewing gum. And I'm going to tell you why I said no to gum. I wanted everybody to get a piece and see how many people said yes to this gum really quick. So when you start to chew, what happens when you're chewing in your mouth? What happens?
Salivation.
You salivate. You can't answer no more questions.
I was going to say exercise.
You build up those physical activity minutes.
However you can rack them in, right? So you start to salivate, right? But when you salivate, salivation creates a signal down into, let me just give my child this. There you go. Yes. It's straight down home. When you start to salivate, it creates a signal or sends a chain of reactions down to your stomach to say, okay, Mo is getting ready to swallow some protein and some vegetables. Start to make or release enzymes to break down a protein and a vegetable. But the problem is that I never swallow anything if I'm chewing gum. So enzymes are sitting around in my stomach waiting for the party to happen, but the lights never come on. So you got enzymes sitting in your stomach like, she's chewing, but ain't nothing happening. And you keep popping away, popping away, popping away. Then you get rid of that one, you get another one, you're popping away. And the whole time you're like, oh, I'm a little gassy. So you start burping, you start pooting, and now you have these enzymes sitting there. And then you keep doing that over and over and over again, and eventually your body's going to stop secreting enzymes. That's why there's a very high market for enzymes. Because of the gum. Wow. If you keep doing that over and over and over again, but you never swallow anything, your body is extremely smart. It's perfectly engineered to shut off or to kickstart back up. But if you keep chewing that gum over and over and over again, and you're swallowing sugars, your body's like, well, she's eating something sugary, and we're creating this enzyme, but ain't nothing happening. It's going to stop secreting the enzyme. And then finally, when you do eat, you're like, why am I so like things are sitting on my chest? Your enzymes stop working. Your body's very smart. It's not going to kick in until you start shifting the way you eat. So that's the reason why I said no to gum.
I don't chew it all the time. I mean, I've had this gum in my purse for a while.
Yes. Yes.
But I when my mouth gets dry, I will chew it.
I would recommend sucking on a candy versus a gum.
A peppermint?
Or a little piece of ginger candy, something that promotes digestion. versus taking away from your body. Yeah, so it's all about the choices that we make and what you put in your mouth. So you're either going to be feeding an illness or you're going to be feeding a disease based off what you put in your mouth. Yes? And so in turn, that leads us to diabetes. So what do we know about diabetes? Since you've been in this class, what do you know to be true for diabetes?
Carbohydrates turn into sugars.
That's it.
And I know more, but I have to find it.
Okay. so class, so we're out. Yeah, what do you know about diabetes? What is true about diabetes?
It can kill you, one thing.
Take you out. But what do we know in conjunction with food? What's happening?
That is, you're insulin resistant.
Why are you insulin resistant?
Because there are like a couple of different ways. This is really bad because I should know this too. I know one of the ways is that you've eaten so much that has forced your body to produce so much insulin that eventually the mechanism just wears down.
That's the only thing that I want to touch on. Your body is so overworked, it stopped. Right? It just shut off. That's it. Because whatever you were doing, it couldn't handle it. And you just kept doing it, kept doing it, kept doing it, kept doing it. You cannot run an engine without slowing it down or putting oil in it or putting gas in the car. You just can't keep running. Eventually it's going to burn up and burn out. And that's exactly what happened to the body. But the brilliant thing about the body is that if you give it time, if you give it rest, and if you feed it exactly what it needs, it can rehab itself. It can completely come back. Sometimes 10 times better once you do it the correct way. And so how does that link to gut health? Based off everything that I shared with you thus far about what you put in your body equals your output, how does that link to diabetes? Think about it.
Don't look at me.
Very easy. I can't have you answer. You can answer sometimes.
Just sit down again. Sit down.
So based off of what you know about the body now with this discussion, and you know that your input equals your output, and that diabetes is currently present or might be present for some of you in this room because of what you've been putting in your mouth, and knowing what you know about how protein, carbohydrates, and sugar process in the body, how does that link? How does gut health link to diabetes?
That if what you are putting in your mouth is causing high insulin production and it's not moving through, then
it will continue to grow and manifest into an illness. Thus, that's where diabetes kicks in. That's how the two link. You have to have bowel movements every day. And diabetes is just one disease. It's just one that comes from here. All health begins in the gut. Everything starts here. Everything manifests here. Your core is your life. This goes haywire, you're going straight down. Literally. There's a joke that says that, the organs are sitting in the room and they're all laughing and talking, and the heart says, I'm the best, and because if the heart stops, everything else stops, and the lungs is like, no, that's not true. If I stop breathing and stop working, then you just die. And the organs and all stuff, they kind of go back and forth with their jokes. And then the colon was like, if I shut down, you guys are all dead. Yeah. And it's the truth. When the colon slows down, you can tell how sick somebody is based off their bowel movements. You can tell how long they've been sick based off their bowel movements. You can tell how much medication they're taking by the smell and the stickiness of the bowel movement. My clients have come in, like I had a client this week, I knew she was lying, just based off of what was coming out of her system. So stuff is coming out, and it's gas, and a lot of undigested food, and the poop is sliding through the tube. I'm looking at her like, she said she's been eating really clean, and her water intake has been up, and stuff is coming out, and she's sweating on my table. I'm like, this is not adding up. This is not right. Then eventually, after she pushed that last big thick poop poop out of her butt. She said, Mo, I can't take it. I lied, girl. I had nachos, I had this, I had that, I had 2 margaritas, and yada, yada, yada. And then she just passed out on the table. She was like, I'm so glad I said that. And her color came back immediately. It was a trip. It's a trip. I had a guy the other day, I think, you saw him stand.
Don't use names.
Oh, don't use names. Sorry, excuse me. No names. But he came in and he was getting ready for a prep, actually. But he was sick. He's been sick for a little while. And his color was gray. Very, very gray. First colonic, he had a little bit of pinkness in his neck area. Just a little bit. Second colonic, he came back the next day, had a really, really, really good release. Color came all the way back. And he was like, well, I think I might reschedule my colonoscopy. And I was like, no, just go. Go ahead and get it done because now your body is clear.
But what's the pink? What is that when you're...
So your healing starts from inside out, from the bottom up. Normally, illnesses start from the head down, from the outside in. So when you start to heal, it's the opposite way. It heals from the inside out, from the bottom up. When you think about illness, most people have swollen ankles, swollen feet, their knees start to give out. But it starts here first, though. They start to feel anxiety, frustration, confusion. They're tired. Then their eyesight starts to go hazy. Then they start having heart palpitations. They get tight in the chest. Then they start sitting for long periods of time because they just don't want to move. They don't have the energy to move. Then you start noticing the weight gain around here because they're not moving. Now all the swelling and edema starts to work down the legs. That's normally how illnesses start. But when you start to heal, it starts from the feet or the bottom up and then from the inside out. Right? So always remember that what you put in your mouth is going to either feed wellness or feed illness. One of the two. That's how you can choose. Is this going to give me health or is this going to give me illness? Once you base your food intake off of that, you're going to make very, very different choices. Very, very different choices. And then when you start to feel a certain way here, you know that illness starts in the head first. So now you can start making better decisions. You can start changing it. Yeah? Awesome.
So, can you talk a little bit about gut health and when you find yourself plateaued in terms of weight loss and some like what that might mean? You're eating well, you're physically active.
Yeah.
But for some reason you've reached this plateau in your weight loss.
It can mean a couple of different things. When you plateau, and it doesn't matter if it's weight loss, if it's your health, if it's your sleeping patterns, it doesn't really matter. Health is a sum of everything in our life. You have your personal life, you have your family, you have your career, your work, your business, you have your children, you have your spiritual, and you have your self-love and your food. All of these areas need balance. So when you reach a plateau, there's something in your life that has also become stagnant. So when you step back and you look at these 6 areas, something is going to be off. Once you give attention to that area, your weight loss will start to shift. Your plateau will start to shift. And then you start moving to the next level. But the areas in your life, you have to look at them constantly. It's a constant balance. It's a constant shake and shift. And it's a constant step back and look at everything. But anytime you plateau, take a step back, write these areas out, and see where you may be having some stagnation. It could be stagnation with a conversation you need to have. It could be a job you need to let go. But something is stagnant somewhere. And it's going to manifest physically in your body.
It could be your exercise routine. That's what I was talking about. When that plateaus, you're no longer increasing or shifting, and that's the stagnant piece.
That's your self-care.
Yeah.
Look at that area. It could be time for you to shift something. It could be time for you to drop that personal trainer and really get focused and honed in on what you need. But at some point in time, there's some shifts that need to be made somewhere. When we get comfortable, you're no longer growing. When you're uncomfortable, there's some growing that's taking place.
Yeah. My physician told me that if I walk around the corner every day for a year, at the end of the year, I'm going to be in worse shape than if I didn't do it at all. Because my body will totally acclimate to that once around the block.
You want to do things that are going to stimulate you mentally and also create some type of sweat and get your heart rate up. If you're doing 10 laps every day at the same pace, your body's going to plateau at some point. And it gets comfortable and it gets acclimated to that. 10 laps at the same stroke, in the same pool, in the same method, in the same swimsuit.
The lime green.
Lime green.
Yes, is your
Right?
favorite.
Sometimes I got to change it up to polka dot, and then I maybe have a little bit of different feel. So now you may have to do 15 in the same time period. So now you're stressing it. You're moving it. Now your heart rate is up. Now you're sweating. Everything's different now. And then your mindset is different.
You know, that really speaks to, in the program, what we push for is 150 minutes of physical activity. And it's very easy to get locked into the same thing every day. But what you're saying is that it needs to be varied.
It needs to vary. And the same thing with what we do every day as far as where you pray, how you take a shower. I normally turn the dials with my right. Now I started shifting it. It's all over the place. I'm touching all kind of dials on with this hand. You know, the same thing with your soap. I usually do it like this. Turn the opposite way. When I dry off, I usually do the towel like this. Now I go this way. And you know, little things like that we do every day. It'll challenge the body to constantly stay in the level of growing and expanding, growing and expanding. Instead of sitting in your bed on the right side, get in on the left side and roll it over. Do some stretching before you go to sleep at night. Instead of pouring your juice or your tea with this hand, pour it with that hand. Very simple things, but we get so comfortable and we get so set in this routine, then your health is going to get set and stagnant in that routine. And you're not going to notice anything.
It's almost like you go on autopilot though. And so then you're not cognizant and you're not aware because you're just cruising.
Yeah.
So awareness, constantly being aware, constantly dialing in. We do things to check out. That's the biggest aha that I learned for myself, is that I'm doing this because I want to check out. But most people want to check out because they don't feel well and they're tired and all they want to do is lay down because their body is so overworked. So checking into these points in the day where you want to check out, ask yourself, why do you want to check out? Because you have been catering to yourself all day long. You've been giving to somebody else. And then that's when we get the wine and the cake and all that good stuff. And it's this continuous cycle. But now that you become aware of it, what can you do? You can make a better decision. And that's, in that moment, that's when health begins. That's when you start choosing maybe some water over a soda. Or slicing up some limes and putting it in there and making it pretty. Or putting it in a wine glass. Like I serve my clients in wine glasses and pretty glasses that my mama gives me. And I serve my clients that way. So treating your body nicely, catering to it at all times, not just when company comes over. So it's being aware of how you're treating your body from morning to night. Slowing down when you're driving. Turning the music off for a second. Rolling the windows down. You do those things to go on autopilot. You turn the music up so you can drown out everything else, including yourself. Listen to your thoughts. You will be told everything that you need to do when you do. Like when you said, there's something floating around, I think it may, I don't know what I'm going to say it, but your body tells you everything, but we drown it out. We don't want to hear it because it's truth. And if it's truth, that means you got to make some changes. But if you drown out, you ain't got to deal with it.
Except you do over the long haul.
Exactly.
Yeah.
Exactly.
Right.
And most people go above and beyond to avoid their weight loss, to avoid the pain that they've been having in their neck for the last 6 months. And now it's radiating all the way down their arm. Now their arm is numb. But you've had this issue for 6 months. Well, I couldn't, I didn't, I shouldn't. Well, now your arm is jacked up. Now you can't work. Right. However, the body is brilliantly designed to rehab itself if you listen to it. Aches and pains are signs. They're signs. They're warning signs that something you're doing every day is not working for us. And I'm going to get louder and louder and louder. The next time you might have an accident. You may black out. You may burn yourself. You may fall. And you go, oh, why did I have an accident? Your body has been screaming at you for the last 3 months. The no bowel movements, and then when you finally have a bowel movement, it hurts. And when you go to wipe yourself, there's blood. But you've had signs for 3 weeks prior to that. But you keep drinking the coffee, you keep drinking the soda, eating the pound cake, and not changing anything because it tastes good going down because we're drowning stuff out.
And it feels good.
Yeah.
Yeah.
It feels good in that moment,
Yeah.
for that second, until you're in the hospital with a tube down your throat. Being healthy feels fabulous. You can't tell me nothing about not being healthy. I will never go back to that space again. You can't tell me nothing about colonics because I will walk away from you. I've rehabbed my body 5 times with eating clean, giving myself a peace of mind, whatever that means, however that looks like, whatever it is, however much it costs. I'm going to go for that peace of mind. If I have to drop people out of my life, then so be it. I'm going to do it. Because I'm not stressed out anymore. Every now and then I get stressed out. But not to the point where it hurts me. It's not worth it. We have one body. I read somewhere it said that God gave you 2 sets of teeth and the third one's going to cost you.
Right.
Yeah. You got 2 sets of teeth, and after that, you on your own. You have one body. One. You don't get a loaner. This is it. I don't need any more reminders. I'm good. One reminder, that's it. One scare, I'm good. No more for me. You get one. And your body is constantly ticking for you. It's constantly working. It's constantly working. But we keep bumping it, abusing it, not taking it for a walk, talking badly to it, putting whatever you want to put on it. You got one body.
Not checking when the engine light goes on.
Oh, we spend more time looking at shoes and jewelry and makeup and the eyelashes and the weaves and everything versus putting what we need into our bodies. If you take care of your body, you won't need eyelashes. I'm just thinking you won't need them because you have your own beautiful long eyelashes. If you took care of your body, you wouldn't need makeup. If you took care of your body, you wouldn't need deodorant. Deodorant is an expensive business. You know how much deodorant costs? It's like $5. Yes.
And depending on if you're young and your body's going through changes.
Yes.
My 14-year-old, oh God. Oh.
That stuff costs money. But
And-
if you take care of your body, you won't need that at all.
I don't know if you had a chance to watch the video that I sent to you, the TED Talk.
No, I haven't watched it yet.
A physician did a TED Talk about type 2 diabetes. It was awesome. But something that she said that just, I was home alone watching it in front of my computer. I stood up and cheered. Is she said, we have to stop treating food with medicine. And I said, that's exactly what we do. The problem is like what we're eating, and then you get sick, and you go and get medicine for that. It's like when what you need to be doing is making different food choices. So, oh my goodness.
You know,
Food is the medicine.
there's one thing that a lot of my clients all have in common. Most of them have had their appendix removed. And it's connected to the food and pooping. So your appendix is about as big as your finger, actually, maybe give and take an inch or two smaller. That's how big your appendix is. And it hangs off of your colon, just like that. So the part where the appendix is right connected to the cecum. The cecum is the part of the colon where the small intestines dump into the large intestines, and then the food or the waste moves upward, right? But right off the cecum, just like this, is the appendix. So if I'm sitting all day long and the cecum is right here, where's the appendix?
Underneath it.
Exactly. And if I'm not pooping on a regular basis and I have all this girth around me, what's happening to this little bitty appendix here?
Suffocating.
Compressed.
It gets compressed. Now, if I'm not pooping, and if I should have brought the picture of it, the appendix has a vein in it. If there's a vein in there and there's an opening, that means that if this is the cecum and this is the appendix, poop can seep into that vein. So now if there's pressure on this cecum and it's pushing fecal matter into this vein, the appendix is only as big as my pinky finger. It starts to swell and it gets inflamed and it's raw. Now it's angry. Now you go into the hospital and you can't even stand upright because you've been doing this girth thing for a little while, not having bowel movements, and they go and say, oh, your appendix is swollen, let's snip it out.
They take it out if they just go anywhere in. Now,
Right.
Even if you don't have nothing with it, if you have any operation around that,
They snip it off.
they just take it out.
But all you have to do is A, stop eating the way that you're eating, B, increase your bowel movements by drinking more water, and stand up and bend over and breathe. It's very simple. They go in and they cut it out because it's inflamed, it's raw, it's angry, and it's getting bigger and bigger and bigger. This cake, mine, I don't know about yours, but mine can't take a whole lot of pressure. Look at my finger. So anytime you have pain on this side, you just need to poop. Massage it. Stand up, put some castor oil on it, massage it. I promise you, you're going to be pooping in about 30 minutes. About 30 minutes, it's going to come down.
I had an episode about 20 years ago where they said mine exploded, but they never took it out. I had a drain from right here, and they didn't do surgery or nothing. They just put that drain in. But then years later, I found out that I still have my appendix. It never exploded, but something did inside of me, and they never could tell what it was. I had a mass on my ovary. That was one thing. I've had a lot of trouble down there. But yeah, they say that I still have my yeah. So I don't know what
That's a good thing.
quack.
I don't know. It could have been a lot of different things. What I do know about the body that I absolutely am in love with in regards to the body and how it works is that anytime there is infection, bacteria, or waste in the body and it's accumulating in the body will bring it all together in one space and hold it. That's what a fibroid is. That's a tumor. That is a cyst. That's a pimple. That's what boils are. It's a collection of waste. So anytime you have somebody who has acne on their face or anywhere in their body, they need to cleanse. If you're prone to boils, you need to cleanse. If you're prone to yeast infections, you need to cleanse. If you are having floaties in your eye, you need to cleanse. So this is your body telling you, I am overloaded with waste. I need to cleanse. It'll pull it all together in one area and it'll hold it there. And it's doing that to protect the body. It's a protection mode.
But it doesn't want those toxins all over, so it's.
You know those, what do you call those things? Gumballs. That's waste. That's waste in the body. And it's pulling it all together. There's something going on in your mouth that is an abundance and your body can't deal with it. And it'll push it all together in one spot and it'll hold it there.
What do you mean gumball? What's...
Abscess.
Like abscess, yeah.
Oh.
In your gums or in your cheek, and it just gets really big and you pop it and you're like, ugh. Yeah, it's salty. That's waste collecting in the body and it's trying to push it out.
You know, you talked about having floaters in your eyes. I had 1 or 2 floaters in my eyes, and I went and got colonics
surely
with Mo
did.
2 days in a row. Gone. Haven't been back since.
What did you do?
I got colonics 2 days in a row. So the first day, waste. We laughed at the stuff she saw and found. I had undigested nuts. I was eating nuts every day.
A plethora of nuts. And
And I was
it
like,
was
what
so-
is that? And she said, those are nuts. And I'm like,
it was
no,
so
they look like
many
nuts.
nuts
They
in
hadn't
the
even been
waste.
digested.
I could have took it out, served it back to her on the plate.
It was crazy. So you know that so then I know I really like nuts, but my body doesn't digest them, so I stopped eating them. It's like, oh, okay, I need to know that. That means I wasn't benefiting from that at all, except in bulk. But so the first day, all the stuff moved through. We hit my liver, and it was really, you can feel it a little bit, and then it was like everything changed color and texture to like a bright yellow. And I was like, what is that? And she said, that's your liver, cleansing. It's like, oh, okay. But then the next day, we basically just rehydrated. It was, there wasn't a lot of waste. Thank you.
So you're awake when they do that?
Yeah.
Oh yeah, so the way that a colonic, thank you, the way that a colonic is administered is very easy, gentle, and mild. It's not abrasive at all, it's not aggressive. Most of my clients tend to either have a conversation with me, or they go into a meditation mode, or they just go to sleep. And it's a very small speculum that's inserted into the rectum. You're covered throughout the entire session. You're on your back with your knees bent, and I have a towel over your legs, but you do have a medical gown on. And in order for me to insert the speculum, I roll you over to your left side, and I insert the speculum, attach the waistline and the waterline, roll you back over, then I start to flow of water, very easy and very gentle through the colon. It's literally like a trickle effect of the water flowing through your body. And I do that for a couple of reasons. A, because most people are severely dehydrated. So the inside of the colon is the same consistency as the inside of your cheek. Your inside of your cheek, your colon, and your vaginal wall are the 3 most absorbent tools ever in the body. Your cheeks are absorbent because you have to absorb nutrients, and they start the chain reaction. Your vaginal canal is very absorbent because you have to absorb the sperm or the cervix. You know how we all got here, literally. And then the colon is the same way. The colon is the last part of the body before portal of exit. And it's the last part of the body where you get the last of the nutrients and water pulled out of the waste, and then everything else is excreted. Right? So when you start to flow water through the colon, my whole goal is to hydrate the body from the inside out, because again, the body's going to absorb the water. So if your colon is going to absorb the water, what's sitting right on top of the colon? Your stomach, your uterus, your prostate, your kidneys, your liver, your gallbladder. So all of these organs are getting hydrated. If there's hydration, what is there? There's life. Things kick into gear. When you take water away from anything that's alive, what happens? It dies. And that's why people's color come back, because they have hydration in the body. Your body, if there's sickness in the body will only do the bare minimum to keep it going. The bare minimum, which is respiratory, is going to get you to breathe. Circulation is going to pump your heart, and your eyes are going to be open, and a couple of your senses are going to be there. Not all of them, but just the ones you need at that point in time. Like if you need to drive, Your sight and your hearing are going to be turned on, but your digestion is going to be turned off. Yep. Mm-hmm.
So when you spoke about the absorbency of the vagina, of the cheeks, of the
Colon
colon,
wall.
is there a male equivalent to the absorption function of the vagina in men?
Prostate.
Oh, okay, same thing. Okay.
Prostate. Yep. Yep. Everything. And so, and that's a good point there, because a lot of men, well, not a lot, but I have a good amount of men who come in over the age of roughly like 48, 49, and when we do the intake form, if it's a woman, I ask, do you have any issues or challenges with your uterus, fibroids, or ovaries, or fallopian tubes? Not fibroids. Fibroids is a challenge. But do you have any challenges with your uterus, your fallopian tubes, or your ovaries? And then we'll go through that whole process. And then if there's a man that comes in, I ask, do you have any challenges with your prostate? You have to remember that all of your organs sit right in the inside, and then your colon sits on top of that, right? So for a woman, my uterus is here, fallopian tubes here, and then my ovaries are here. For a man, your prostate is a little bit lower, just a little bit lower. So if you have a colon that's distended, that is full of air, mucus, undigested food, and everything else we don't want, it's going to press down on that prostate. That's the number one reason why there's Viagra. When you really just need to hydrate and poop. Just hydrate and poop. You do that, you come right back alive. Same thing with women. There's a reason why your body is going through all these challenges with hot flashes. Your body is trying to push off waste. Most women go through menopause too soon, way too soon, but their body is consumed with all of this waste. You flush all that waste out, your body's going to normalize itself out. By default, it has to. If you have a hydrated, alkaline body, you're not going to go through mood swings. You're not going to go through hot flashes. I was listening to actually me and my mom were listening to Dr. Robert Cassar on YouTube, and I recommend that everybody listen to him.
Spell that last name.
Cassar, Cassar. He is on YouTube. His first name is Robert, and he was a chiropractor for years. And he was talking about internal detoxification and cleansing. And he spoke about the way that a man urinates. And I don't know anything about this. But he says that a man urinates up and down, but in a spiral. I was like, is that why my son is all over the place doing? I get it. But he said that that's how you can tell if the man is healthy or not. And he went into more detail about it, and it was completely over my head because I don't have that plumbing. But in essence, your body will tell you everything if it's going right or if it's going left. But we don't pay attention to it. So if you're having a very shallow urination stream, there's reasons for that. Most of the time you need to cleanse. And that was the main reason why he's clicking the two. Your body's overworked.
Okay, so we have to talk about the squatty potty.
Yes!
Yes.
Yes!
Gotta talk about that.
Yes. So squatty potty is a method of squatting over the toilet to eliminate. So when you sit down on the toilet, most people sit on the toilet like this, right? And we're hunched over and we're sitting down. So if you look at my spine and the way that my body is, it's all hunched over. But when you sit on a squatty potty, your body is lifted up like this. So it elongates the spine and the colon is elongated. But when you're sitting on a regular toilet, you're like this, which collapses the colon. It's already this big as is. And then you sit like this, now everything is closed and built over. But when you sit on the squatty potty, it brings the knees up so that the tailbone drops down. If the tailbone drops down, the colon elongates and opens up. So now,
Where are squatty potty?
you can get it at my office. You can get it at my office.
Will you sell them?
I do.
See
Yeah,
the-
I do.
They
Yeah.
were selling them at, Bath and Beyond.
Mhm.
Yeah.
Ah, okay. Yeah, I
And then there
love
was
them.
an infomercial, a woman was selling them on this infomercial.
Yep. Makes a world of a difference.
A
And in
world
the,
of, and so if you get urinary tract infections a lot, you know, urethra inflammation, that kind of thing, this is like so much better. And you get a better, a more complete and thorough urination and defecation elimination. It's like
because the body opens up. If you elongate your spine, the body is like an accordion. But if you sit like this all day long, no wonder everything is collapsed and everything is pushed out of the way. When your colon is distended and inflamed and puffed up, it pushes other organs out of the way. It's going to push your cervix down. That's when women have prolapsed uterus. They just need to poop. And they have all these surgeries, get the mesh net and pull it back up and yada, yada, yada. You just need to poop and tone. You can tone by drinking water. If you pour anything that was living, that's shriveled up, you pour water on it, it starts to plump up. And it will naturally move back to where it is. So everything that we do with this vessel here is going to determine if you're living or dying. Period. The way that we sit, the way that we eat, the way that we drink, the way that we talk to ourselves, the way that we deal with other people, all of that plays a role in your health. Everything. Everything. Any questions?
Hey, I never knew about these squat, what you call squatty
Squatty
potties.
potty.
But if you just put your feet on,
Mm-hmm.
is that the same as squatty?
Yes,
Yeah.
yes.
Yeah.
As long as you elevate your feet and your hips are lower than your knees, you're in the right position. But if I'm leveled like this, there's no change in my colon. But if I dip my hips lower than my knees, then the back elongates. The colon straightens out. And I can just drop right down. You shouldn't be sitting on the toilet long enough to go through your Facebook feed.
Right.
Or to read a book.
That's why it does work. You know, I used to do like feet like that. Your feet get tired, but got it from you. And I mean, it works.
Right.
Yes,
It
it
drops
works.
right down.
Drops like a shoe, like a trap door.
So what you're saying is, we all need a squatty potty. Those that don't have it.
Or to, like you said, just, you know, a stool or something to elevate. And I'm like, you know, because we grew up in the same house. I did this for a long time. And it's like, oh, but nah, they have this thing. It's great because it fits right around the base of the toilet. So, you know, you just pull it out and
Sit your feet on top.
do your
exhale,
elimination.
let
And
it go.
then when you finish, you just push it back. It fits right around the base of the toilet, so it's out of the way.
Well, actually, since I am shorter than everyone else in here, I've always been doing this.
Okay. Well, there you
I
go.
really have always been doing this because my legs were never long enough to sit right on, you know,
Yes.
basically.
That helps, but that pot gets it up this high,
Yeah.
as opposed to this high.
Yeah.
I mean,
Yeah.
it works.
And when you start eliminating more, you'll notice that this here will start to go down. Because truly what was sitting there is just waste. Yeah. So one of the things that I do with my clients, especially my new clients coming in, is that I do a body composition with them. And then I have a scale where you stay on the scale and it will tell you your true body weight, your metabolic age, your bone density, your body fat, and your visceral fat. Visceral fat is the fat that's in your abdominal cavity. But if your number is a little bit higher on that scale, let's say like 13 and above, anywhere between 1 and 5 is really good. That means that your input is equal your output, and you're going and it's coming and it's going and coming. When you have a 5 up to about 12, it's still doing the same thing, but it's just a little bit slower, but it's still moving. Any of my clients that get a score from 13 above, they have this going on. And I can already tell when they come in. Basically what's happening is that, again, your body is perfectly engineered to do something with the waste. So what happens is that your body starts to reabsorb that waste and turn it into fat. They're gonna do something with it, but here's the problem. You can't reuse trash. It's trash. And that's when you start slowing down. You don't feel well. Your fingers start hurting because you have trash circulating through your body. It's not feeding anything.
I want to make sure that, because we're streaming live and then of course we're going to capture this video, but tell us where you are and how people can find out more. And someone wants to know, where do you buy a squatty potty?
Squatty potty! So my office is located in Torrance, California, and my address is 1001 West Carson Street, Suite E as in Everbest. And my business name is Moya Body Care, MOYA bodycare.com. And that's the website as well. And the squatty potties are $22 at the office. You can stop by and pick them up anytime. And I'm also on Facebook under the same name, Moya Body Care. And then if you have any questions, you can always call me at 562-682-0818. And I will do my best to be available and answer any questions that anybody may have.
Booyah. Thank you.